Hi, I'm Dr. Walt McConnell. This is Dr. Dan Larson, and we're here to discuss the crisis in American healthcare. Um, we do have a crisis, and do we want to finance it? Do we want to have a bailout, or do we want to fix it before we finance it, as Senator Max Baucus has said? Doctors are also leaving primary care. They're not entering primary care, so it's both ends. They're leaving and they're not going into it. So we have a marked deficiency of primary care physicians, and unless we fix that, we're going to have the same problem that they have in Canada, that people cannot get in to see a doctor, and they wind up going to our emergency departments. Our emergency departments are being closed right and left all over the United States because of hospital competition, various other reasons, and our emergency rooms are overloaded. Plus, our patients are not getting any instructions in wellness and prevention, which President-elect Obama is stressing, and we need primary care people to do that.
This past summer, we started 2 new primary care doctors, full-time. We never advertised them, we never announced them, there wasn't anything in the paper. There wasn't even a flyer in the waiting room yet. Their schedules were full before they started. It's very difficult to get young doctors to seek primary care as a career.
Why is that then?
Don't want to sound too mercenary, but a lot of it's just simply money. The average primary care doctor comes out over a couple $100,000 in debt. If they can go into a subspecialty where they make 2 or 3, 4 times as much, why should they go into primary care?
Actually, I think it starts in the pre-medical student, because at least in my experience at my university at Bucknell, talking to young pre-meds, they're already making up their mind that they're going to go into a specialty because they know the statistics about the income of the primary care docs, and they're not choosing primary care even as pre-meds. So, you know, we've got to start changing people's mind at a pre-med level.
You know, in a current third-year medical student program, I think they have 1 month of real primary care, perhaps 2 months if they're lucky, out of the 12 months. The emergency room physicians want to see the people that really need to be in emergency rooms. That's why they went into emergency medicine. They like that. They don't want to see the people who've had a bad cold and a bad cough for 3 days and couldn't get in to see their primary care doctor. If they'd gotten in to see their primary care doctor, they probably wouldn't have landed in an overburdened emergency room, increased the waiting times, increased the congestion, and maybe our healthcare system wouldn't have paid for a chest x-ray or worse, a CAT scan, just because someone has a bad cold or bronchitis.
Each specialist is looking at you through tunnel vision and doing the tests that are indicated in their specialty, not as a whole person. And this is what the primary care doc does. He looks at you as an entire person.
And the amount of testing that gets done when you go to see a subspecialist, you can't blame the cardiologist for saying, I want to do a nuclear stress test, which, gosh, I don't know the cost of those, $1,000 probably by the time you take all the fees, where you might listen to them and find the complaints, say, that really just does not sound like heart pain. So you don't blame the cardiologist, but that's their method of operation. They're used to testing.
Right.
And the orthopedist is used to doing an MRI scan of the knee rather than discussing with the patient, even if you have something on there, I wouldn't operate on you yet.
Right. The big central issue is, let's get back to primary care. Let's look at the patient as an individual. Let's treat them as an entity. Let's teach them wellness and prevention, reduce their healthcare risks so that they come in well rather than sick.
Right, and it's a lot more cost efficient, besides better for the patient, if you prevent a heart attack rather than put in a stent after the patient has had the heart attack.
Exactly. Everyone has to get together and work it out. The medical schools have to get off encouraging people to go into specialties. The insurance companies have to pay the primary care physicians at a reasonable rate so they make a good income, equivalent to the rest of the medical profession. And the government could set up a program where they subsidize medical students who will go into primary care and go to areas where they're needed and and give community service. All right, now that we've discussed the crisis in our healthcare system, we would encourage you to go to our website, which will be posted at the end of this YouTube, and we would welcome your comments about your experiences with primary care or the lack of primary care, or any other comments you have about our healthcare system. We would hope that we can get this information to our politicians who will make the final decision about where our healthcare system will go. We would also encourage you to watch for updates on our website and possibly on YouTube about our upcoming documentary, Money Driven Medicine, produced by Alex Gibney, last year's Oscar winner, and directed by Peter Bull.